We're going to break this down from small cells so you understand certain principles. Now, on the screen, you see fibroblasts. Those are a type of cell that make up muscles, tendons, ligaments, joint capsules, fascia, pretty much any soft tissue that you can think of are created from fibroblasts. So when we know this, we can look at recovery and even any muscle work from a different angle because tissues adapt from forces, especially over time and in certain stretches, certain directions, and how the tissues move. That becomes a factor. When we look at this, especially healing a tendon or any ligaments, they don't get as much blood flow, which if you don't have blood, you're not going to be able to send materials to the area to help heal up those tissues. Like you see a couple surgeries from past examples to where you take a tendon out of one area and then use it for a ligament in another area. Now, when that surgery happens, you have a tendon acting as a place of a ligament, which for tendons they attach from muscle to bone, and ligaments are from bone to bone. However, when they go back and look at images, they can see that tendon actually becomes a ligament because it adapted to the forces that are required for that area to function. And that's where physical therapy, that's where rehab comes into place. So just knowing that aspect, we have to look at in terms of muscle work, in terms of rehabbing, we have to look at how much force can that tissue absorb, how how much stress can it hold without giving way, without tearing. And that finding that fine line is difficult, but that's where you have to look at the individual as a person. You have to see, do they have any past injuries to the area? Do they have any compensations? How's their overall systemic inflammation? Because if they're inflamed, they'll prolong and inhibit some of the recovery aspects too.